safety of chemotherapy drugs. But before going through the research, we need to answer two questions. What is medication safety and why medication safety is important? Medication safety is important because of the patient care, as medication error is one of the leading causes of complications and death. There is a pressing need for better understanding of the nature and scope of medication errors and the will to improve the current clinical delivery systems. The chemotherapeutic agents are associated with severe adverse effects, which is leading to decreased quality of life and also economic burden. So the issue of medication safety in chemotherapy drugs is highly significant when anti-cancer therapy is used as a treatment modality due to the high hazards derived from these agents and the disease context in which they are used. The complexity of treatment regimes designed to achieve the maximal anti-cancer effect balanced against acceptable toxicity, which leaves a limited margin for error, as overdosing can result in death due to treatment-associated adverse effects, while underdosing can have significant implications for the management of the disease and to the patient outcome. The purpose of this research is to determine the error in prescribing, dispensing, and administration of chemotherapy drugs and related agents used in the treatment of cancer and to promote the prevention of medication errors to improve patient outcome. It was an eminent observational, non-interventional study which was done at the oncology department for a duration of half a year. All patient-related data was gathered according to case record structure. This research was done to evaluate the complete reporting of prescription errors, classify prescription errors, complete revealing of medication administration errors detected by nurses, classify watched medication administration errors, formulate improvement procedure, monitor and register the occurrence of side effects, assess how to overcome side effects, and also evaluate the antiemetic treatment used. The total number of 70 patients were observed for the research, which 22 were males and 48 were females. Further order dependent on the age uncovered that in the majority of the patients, both males and females were in the age range between 20 to 65 years, which most of them had experienced 1 to 3 chemotherapy cycles, and only around 5% of them experienced 6 cycles of chemotherapy, which was mostly due to maintenance chemotherapy. The most common endorsed chemotherapy agents in this setting were cisplatin, carboplatin, paclitaxel, oxaliplatin, doxorubicin, and docetaxel. The most prevalent type of cancer in females was breast cancer, followed by blood and bone marrow, cervical, ovarian, lung, non-Hodgkin lymphoma cancer, colon, and stomach cancer. Whereas in males, it was blood and bone marrow, followed by lung cancer, non-Hodgkin lymphoma cancer, colon, and oral cancers. The most common type of cancer below the age of 20 was blood and bone marrow cancer, while within the age of 20 to 65 years was breast cancer in females and oral cancer in males. And also, over the age of 65, it was breast cancer in females. While in men there wasn't any significant type, as the occurrence of all the cancer types were shown to be equal. According to our research, the most influenced organ framework in both females and males was gastrointestinal tract and skin and subcutaneous tissue, musculoskeletal, blood, and nervous system. Most of the patients have suffered the side effects related to gastrointestinal tract, such as nausea, vomiting, diarrhea, and decreased appetite. The majority of the patients experienced pain all over their body, especially in the muscle and joints, and also most of the patients experienced alopecia. There are many side effects resulting from the use of chemotherapeutic agents, and rapidly developing cells have been shown to be highly affected by these agents, like hair follicles, skin, and the cells that line the gastrointestinal tract are some examples of the fastest growing cells in the human body, and therefore are more sensitive to the effects of chemotherapy. For this reason, patients may experience hair loss, rashes, diarrhea, respectively. Our analysis showed that all of the patients have used antiemetics in their treatment. The antiemetic used was either a single antiemetic or a combination of antiemetics. Ondansetron was prescribed for around 81% of the patients and used at doses of 8 mg and 16 mg, of which 8 mg was most commonly prescribed in patients recommended with a single antiemetic treatment, while the utilization of 16 mg was applied in medications containing more than one antiemetic. Dexamethasone was endorsed in about 44% of the patients with a range of 4 mg to 20 mg. Among these, 8 mg was the most normally utilized dose, separately as well as in combination with other agents. The other antiemetic, aprepitant, represented around 24% of the medications. Polonosetron was also recommended in this setting. Aside from the antiemetics, other pre-medication utilized were pantoprazole 20 mg and 40 mg and rabeprazole 20 mg. Of these, pantoprazole 40 mg was the most commonly used, representing about 72% of the total prescriptions. Using the antiemetic agents diminished the occurrence of nausea and vomiting in patients receiving chemotherapy. All of the patients got an antiemetic medication before the chemotherapy. Ondansetron, polonosetron, and steroid drugs such as dexamethasone and aprepitant were the normally endorsed pre-medications in our setting, either separately or in combination. The pre-medication generally recommended for this setting was ondansetron 16 mg and dexamethasone 8 mg, either separately or in combination. Cyclophosphamide, carboplatin, doxorubicin, epirubicin, oxaliplatin, cytarabine, and ifosfamide were the drugs used in cases of moderate hematogenicity. In this study, the pre-medication used by the patients were ondansetron with 8 mg and 16 mg doses, dexamethasone with 4 mg, 8 mg, 16 mg, and 20 mg doses, palonosetron with 0.25 mg dose, and aprepitant with 125 mg dose. In this research, the error percentage in the prescription as well as in the administration of chemotherapy drugs in an oncology ward was also established. Out of 70 number of prescriptions, the total error percentage reported in relation to the total number of prescriptions was about 24%. From this, 10% were due to drug-drug interaction, 2.8% due to an unclear to read, 2.8% because of lack of patient's age and also poorly written medication order, 1.4% to lack of date, and also bad handwriting, which made it difficult to read. In case of drug administration, which performed by nurses, the total error percentage reported in administration of chemotherapy drugs in all 70 patients was 11.4%, out of which 2.8 were due to wrong administration dose and drug administration outside the guidelines, 1.4% to errors related to the speed of intravenous drug administration, and also 1.4% to wrong administration technique. Currently, there are no sufficient strategies for estimating medication error rates, but a repeat of declared medication errors made the healthcare system to check carefully the quality with which medication errors are looked for, the procedure used, the patient populace, and the importance of errors. We have concluded that a nurse is the perfect single individual to detect a medication error by routinely serving the suitability of the medication and differentiating the substituted drug to the doctor-composed request. Although everyone should clearly promote a medication error presentation or reduction. Our investigation shows that the medication administration error may fundamentally move toward nurse dispensing and organization. Our outcomes propose that in order to improve the formulation of medication administration error prevention strategies, each therapeutic center should initially be aware of where in the process of mentioning, apportioning, and overseeing medicines the overwhelming number of medication administration errors starts. Adverse effects. The overall adverse effects observed in both genders were practically identical. Nevertheless, the effects on gastrointestinal tract and musculoskeletal system were higher in females, which may be explained by a higher affectability of this gender by these particular effects. Iron deficiency is seen as a moderately basic condition in patients with disease, particularly those with solid tumors, lymphomas, and receiving myelosuppressive chemotherapy. The treatment for chemotherapy-induced anemia started when the hemoglobin level fell beneath 12 mg per deciliter with oral or intravenous iron enhancements. Also, blood transfusions were picked in serious cases. In our setting, these specialists generally recommended ferrous sulfate, folic acid, and vitamin B12 prophylactic. For limiting oral mucositis, specialists advised patients to have great oral hygiene, avoid spicy food, utilization of mild flavored toothpaste and sodium peroxide mouthwashes 3 to 4 times per day. The adverse effects related with the utilization of anti-cancer drugs were assessed during half a year. The adverse effect prevalence encountered and experienced suggests that all patients getting cytotoxic medication may endure at any rate one adverse effect. Nausea, vomiting, decline, appetite, alopecia, anemia, nail discoloration, and anorexia were the most prevalent adverse effects detected. The frequency of adverse effects has shown to be extensively high and arose from the utilization of existing pre-medication. Expanding the mindfulness through informative intercession, actualized proper usage of pre-medication, and non-pharmacological treatment are essential for improved personal satisfaction. Treatment rules are noteworthy in light of the fact that they outfit clinicians with a movement of proposition made. The limitation which we faced was the inability to distinguish between immediate and delayed adverse effects due to the difficulty of the patients in recall the adverse effects.